welcome to this episode of our Back Talk podcast. I'm Dr. Michele Perez.
And I'm Dr. Krystal Chambers. And we are going to discuss today how best to manage your lower back pain in the early phases.
Right. So acute back pain. So how do we define acute back pain?
Pain that came about within the past, less than 6 months?
Definitely.
Is considered
sometimes
to be acute.
even in the last few days, right? Because sometimes we'll see patients just in the first few days.
And you'll have this person who has been doing perfectly fine and just doing their normal fun activities or normal work activities. They move a certain way, or they just sometimes can't really identify. They just woke up and they feel like they got injured in their sleep,
right?
So to
exactly,
speak.
yeah.
But they wake up and they have pain, and it just kind of progressively worsens, and then, they wonder how best to manage that at that point.
So I would say I see acute back pain in a couple of different ways. A few different ways. So there's that patient who has no idea what they did. Right? They can't tell. They can't put their finger on something. But maybe if you question them enough, they can go, oh, well, I did do the yard work on the weekend, and then I also did this, and they can tell you a few things. So that may have triggered it. And then there's a patient who knows what they did. It's usually the gym, right?
Right.
Deadlifting.
Yes.
That's a whole podcast
That's
there.
in and of itself.
Sometimes it's the gym. Sometimes it might be a fall or car accident, right? That's
Correct.
a common unfortunate event in Atlanta. And then there's the patients who have chronic issues, right, who have known degenerative problems in their spine, who are stable, doing well, and then something happens and it's bad all over again. So we would define acute back pain as something that comes on suddenly, but it doesn't have to be an injury. It can just be acute on chronic, which is what we would call something that happens where somebody's stable and it happens again, right? So, so those are some of the more common reasons. So, what it has historically been the recommendations and advice for people with acute back pain? We can go back to the beginning of our career, and what was everybody told to do?
Rest, rest, rest.
For how long?
At least 3 days.
It was
any
3
number
days.
of days.
Right.
Right. Bed rest.
Bed rest. Complete.
Nothing.
Complete bed rest.
Do nothing.
We were taught that in training.
Yes.
Right?
Yes.
Complete bed rest for 3 days or longer.
Or longer.
Right.
Or longer.
So now we know that's not true.
Fortunately, we've learned from that, and early activity is encouraged, certainly within reason. I encourage my own patients, first of all, when they come in, they'll tell you the story of how they think they got hurt, or, how this whole situation came about. And you'll do your physical examination on them. It may or may not call for x-rays just based on the story and kind of what you find on your exam. But generally speaking, from that point, we're encouraging some level of activity. The majority of my patients are going to get some physical therapy. If they're feeling bad enough that they come into the doctor's office, they probably need some form of exercise, and I feel better giving them something structured, as opposed to just handing them a sheet of exercises and say, go ahead and go home and do these.
Right.
Yes, my preference is, exactly. My preference is go meet with the physical therapist at least once. You may not need to be going for 6 weeks and twice a week and all these things, but let's get you instructed. Let's make sure that you're doing the exercises properly. Let's make sure they don't hurt.
And you're not fearful of them. And
Exactly.
if you do one wrong and you get hurt, you're never going to want to do those again. So the structured therapy is so important. That's a great point there.
So this person may feel comfortable enough doing those things on their own, or they have the physical therapy orders where they can have access to this physical therapist over the coming weeks to have the therapist oversee that exercise regimen for them.
So patients will often say, what should I do and what should I not do? Should I walk? Should I sit? Should I stand? Whatever feels better, right? I say you have to just listen to your body. But most of the time it will feel better to get up and move around, not go for a long walk, but go just for walk around the house or just like a little walk outside just to keep moving, because movement tends to help in acute pain. Standing still, Laying down is sometimes not comfortable. Certainly sitting rarely is comfortable, right?
Exactly.
Rarely. I mean, of course there's exceptions to that in
Right.
people with chronic pain, but when you have acute back pain, sitting does not feel good.
Right. And how many times have you gone into the exam room and your patient is standing
They're
up against
standing
the wall?
all the time.
Because
Right,
no,
'cause it
no matter
hurts
how
to sit.
comfortable the chair is,
Doesn't
how
matter.
great the chair is,
Right.
doesn't even matter.
Yeah, so
Right.
I just say do what feels better. If it feels better to move around, and you don't have to bed rest, but if you want to go lay down, go lay down.
Right.
But go lay down for a little while. And then sometimes people do have trouble getting in and out of the bed, right? Just like the movement of getting in and out of bed is hard. So rest if you need to. Sometimes patients will do better if they're in a recliner, and that's okay.
That's
right.
okay.
If it feels good to lay in a
Right.
recliner, lay in a recliner.
I
If it
have
feels
many-
good to lay on the floor, lay on the floor.
That's right.
Yeah.
I have a lot of patients who have a problem accepting that.
I know, right.
You know, they
Yeah.
come in and they're extremely frustrated because they can only sleep in their recliner.
I'm like, if
I
you're
said,
getting
it's more
sleep,
important to me that you sleep.
Right.
And if you have to be in the
100%.
recliner, if you have to be on the floor,
Right.
whatever it takes to get you sleeping, because you heal and you get restored
100%.
when you sleep.
So important. That's more important than
Much
anything
more
else.
important.
Now we know that these days. I will even instruct patients sometimes. You might have experienced this before now we're getting outside of the acute back pain discussion, but sometimes if you are doing a procedure on a patient, you get them on the table and you have all those little pillows under them, and they're like, oh, this is the most comfortable I've been.
Right.
Why is this so comfortable? So I'll instruct them how to do that at home.
Right.
Like lay down, get these pillows under your belly because it domes up your back and it kind of takes
Exactly.
that arch out of your back. Or vice versa, go lay on the floor and put your legs up on a chair, and it gets your legs bent, so it takes the tension off the nerves,
Right.
and it flattens out your back, and it makes your back flat so their muscles can finally just kind of relax.
Exactly.
So those are not all solutions for everybody,
Right.
but they're sometimes surprised by they could actually get some relief.
And if you can give them, because they'll come in and they'll ask you, how should I be sleeping? And I want you to sleep however you can sleep.
Just sleep. Yeah.
Right. And so, but to your point, I'll give them those, well, try this. If you're going to lay on your stomach, try that.
Yeah.
If you're going to lay on your back, and et cetera. So
Yeah.
you give them some methods that they can just try at home, because like you said, the same one is, patient can have similar injuries,
Right.
but the same positions are just not going to work across the board.
Right. And, people are desperate. They're scared. They hurt.
Right.
They hurt. Nobody likes to hurt like that. So they are just looking for and even those small little things can make a big difference. So what else can people do at home at first before they get to us? Because they might not need to come to us right away, right? Like they don't always need us right away, the specialist. They might end up at their primary care physician's office, which is completely acceptable.
Yes.
And appropriate, or an urgent care.
Right.
Emergency rooms are not great for this type of thing, right? For acute back
Exactly.
pain, you're going to spend way too long and get very little attention for something like this. So we discourage, I would say, patients from going to the emergency room. Urgent care or your primary care doctor's office are better, just like these minute clinics. I mean,
Yes, and I would agree with that. And if the person has a relationship with a medical provider, then that should be the first stop. And
Ideal,
so
right.
the patients who are already in your practice and something like this goes wrong for them.
Sideways, yeah.
And, they'll call and, they'll call on Monday because over the weekend, this, that, and the other thing happened to them. And so they might ask, is it okay if I try anti-inflammatory? And if you have anti-inflammatory at home and there's no medical reason why you can't take anti-inflammatories, you have not been advised to not take anti-inflammatories,
Right.
well, you can certainly start with that. That's, Aleve or Advil, Motrin, et cetera.
Ibuprofen, right.
Exactly.
Okay.
So those are anti-inflammatories that you could use. I like to call it relative rest when I tell people to rest. Not that you're going to go and be on complete bed rest, but you're going to refrain from those things that make the actual pain worse.
Going to to the gym, or
Going
maybe
to
if you can take a day or two off of work because your commute's long and you have to sit at a computer, so that would be considered relative rest.
Exactly.
Getting away from those prolonged activities,
Those
or
aggravators.
physical activities. You shouldn't be going to the gym if you have acute back pain.
Right.
Most people wouldn't want to, but sometimes people will push it.
But, a lot of our patients are indeed weekend warriors, and they still want to do their sport, and they still want to swing that golf club or that tennis racket. But you probably do need to dial that back and just not participate in that until this resolves.
Right. And so statistically speaking, most episodes of acute back pain will resolve on its own with relative rest, anti-inflammatory medications over the counter. We didn't talk about ice and heat. So ice is fantastic in the first couple of days, first 2 to 4 days, because ice will numb and reduce inflammation.
Exactly.
Heat is not going to harm. I think there's a lot of misconception out there that you're going to hurt yourself with heat because they're told heat will inflame you. It doesn't inflame. If you broke your leg or broke your ankle, you're not going to put heat on it.
Right.
But
and you might just feel more achy, kind of that throbbing kind of sensation, simply because when you heat it up, you'll stimulate blood flow. I've had patients say, I could feel like my pulse, I could feel like my heartbeat in my pain, and you've increased the blood flow there.
Right.
So that's quite uncomfortable.
Yeah.
So ice will do the reverse.
Might be a better idea.
And like you said, after those initial few days, then switch to heat and see if that helps it to feel better. But some people continue to feel better with ice, and that's okay too.
Right.
So after those initial, 3 or 4 days, I tell them, do whichever one feels better for you, which gives you the symptom relief.
Right. So we want to give the body time to heal on its own. If the pain is manageable at home with relative rest, modification of their activities, some over-the-counter anti-inflammatories, ice or heat, or both, and things start to get better, great. Then it's probably going to completely resolve on its own and might not be of any consequence in the future, right?
Right.
Reasons to come to us, if they don't already have an established relationship with us, would be if it doesn't go away after how much time would you advise people to come to us?
I would tell them, if once you've had the injury, monitor things over the next week or so. If you don't feel like you are at least trending in the right direction, if the symptoms aren't beginning to subside, then I would say come in and let us evaluate you.
Right.
I'm thinking about, the person who has their acute back pain, but, you do have some of these patients where right away they also have, say, for example, pain that goes down their leg as well.
Yeah, right.
Which is kind of a different situation.
Right.
But I tend to probably want to see those folks a little bit sooner.
Yeah. So reasons to come in sooner than later would be if after 3 to 7 days, things are not trending in the right direction. Pain is difficult to control.
Yes.
There's a difference between I'm uncomfortable when I take but when I take medications, I'm comfortable.
Right.
Then I can't get any comfort. I can't sleep. I can't get any comfort with any of these modalities, or it's worsening or it's changing in nature.
Right.
I was having only back pain, and then 2 days later, now it's shooting down my leg and my foot is numb. That means something a little bit bigger might be going on that may not resolve on its own, and that's when we might need to see people
look.
and a closer look, right? Yeah.
Right.
So I think that, can you think of anything else that we could tell people to do at home? Oh, people ask about TENS units, which are so ubiquitous and available now. What do you think? What do you think about that?
In my personal feel is it's sort of hit or miss. I don't feel that they're harmful. So if you can access it easily, I would not want to see someone go to great efforts to obtain a TENS unit. But if you have one, I think it's certainly fine.
Has one.
Right.
Yeah,
I think it's certainly fine to use it. And if you get relief, great. If you don't, you haven't invested any significant
they're
amount
harmless, essentially. Right. And then some people do have either a relationship with a chiropractor or will go seek out chiropractic care for acute back pain. And I think in general, I would say that's okay, unless you are in so much pain you can hardly move out of your home, then a chiropractor would probably not even be willing to adjust you, or because they're going to sense that this might actually cause more pain or more harm than good.
That's right.
Or I would say probably the only other category I would be really cautious with if somebody has known osteoporosis, especially a female, and chiropractic may not be safe because of their bone health. Low bone density is what osteoporosis means. So that'd be the two reasons I would say that are pretty clear cut not to do chiropractic right off.
Exactly.
And
then
other
I'm glad
reasons?
you brought up the person with compression fracture, because that's a type of acute pain that will present with a severe amount of pain and would very often be difficult for the patient to manage that with over-the-counter medications.
Much so.
And so those patients mostly, I would say, present themselves pretty readily. And it's sort of obvious that they need to get themselves evaluated sooner rather than later because the pain is so intense.
It's pretty intense, and it's usually going to be more often a female.
More often.
Not always. And they may have a known history of osteoporosis or have the kind of build that we associate with osteopenia and osteoporosis, really petite, maybe a strong family history. So just that would be more reasons to be a little bit more attentive to that person and being a little bit more cautious, working them up a little bit more quickly, things like that.
Agree. Right.
So I think something we also really didn't touch upon is what's the big reason we don't want people on bed rest for 3 to 5 days?
Because we know that they get weak very quickly.
Right. How long does it take us to lose muscle mass? Like days. Just a few days.
And most patients are shocked
Yeah.
at how much weaker they are post-injury when they attempt to resume their gym program that they've been doing forever and been doing successfully, and they try to go back and do those things, and they can't. They can't move the same amount of weight that they used to, or they don't walk as far as they used to, and they feel like the endurance is just not there for that same level of activity.
Right.
So the inactivity on the front end can really put you far behind the 8 ball when you do go ahead and start to try to increase that activity again.
Right. It might have taken us a year to get to that place that you got to from a strength standpoint, and it can reverse in weeks. Days to weeks.
That's right.
Really, and depending on your activity level and your health level, it can go more quickly in some patients. But so complete bed rest is just not recommended anymore.
And just walking.
Right. Keeps your core activated. You're using your back muscles, your glute muscles, your leg muscles. You're pumping your heart. So you're still getting at least a little bit of activity.
Absolutely.
If you can't go to the gym and lift weights or go on the treadmill, you can at least take a little walk and just get your mind off of it. And people will notice it does feel better. Why? Because we're pumping the blood to the muscles, we're moving, and it's the inactivity and the tightening and the stiffness. Right.
Exactly. And it perpetuates more of that.
Right.
It just makes it easier to not move.
Right. Exactly.
Right.
So,
Okay.
All right. Well, I think that does it for this episode of Back Talk. Thank you.